Hello, good evening, everybody. Welcome to our Facebook Live tonight. I'm really very sorry for starting late a little bit, but I've been busy a little bit this Thursday. But anyway, I'm very happy that all of you are here tonight. Everybody, let's see. Please make your comments so that at least I could give you a shout out, everybody. Okay, I know that you're all excited. Okay, but anyway, before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been helping students for almost 25 years pass their NCLEX examination, and also students who who are in the nursing program. So I also help them pass their nursing program, and then also their NCLEX examination as well. Okay, and then also I'm the author of a book that I have in Amazon. So this book is titled, okay, the simple, fast, and easy NCLEX review book. So you can get that from Amazon. And actually, the book is also available in the Philippines, and you can purchase the book in the Philippines. You just have to email matusnursingreviewacademy@gmail.com. And you can get a black and white copy in the Philippines. All right. So if you have my book, everyone, you can please give me a shout out. How did you find the book so far, everybody? Because until now, the book is 5 stars. Okay, so thank you very much also for the students who have been buying the book recently. I really feel grateful for your for purchase, and of course, hopefully that this book will be able to help you in your licensure examination. Okay, but yeah, that's it. So now let's proceed to our agenda for tonight. Of course, everybody's excited for the free 90-day online access NCLEX review. So stay put, everybody, and then after the program, you can stay over so that we can announce the winner immediately, everyone. Okay? All right. Now, another one, of course, if you can please share this with your friends if you can. And then also, if you're watching in YouTube, please click the subscribe button so that you can receive updates. Okay. Now, also a little bit about some shout outs about our book. So, very nice and straightforward book. So, thank you very much, Olayinka. And then also, Vibrant Rose also said that she got the ebook from Kindle. Amazon, super love it, easy to understand. So thank you very much for that. Okay. And also, if you can put your locations, everyone, I'm going to give you a shout out as well, where your location is, everybody. Okay. So for tonight, as what I have said, okay, for tonight, as what I have said, our topic starts with letter I, and that's going to be your infection control. Okay. So lately, we have received feedback from students that they have been receiving a lot of questions on infection control in the NCLEX, especially cohorting patients. So we'll be discussing these concepts tonight, of course, everybody. Okay? All right. So keep your comments, everybody, especially any shout outs that you want or any special comments so that at least I can put a shout out. But before anything else, also, I forgot this, guys. Happy Nurses Week to everyone. This is our special week or special month for all nurses who are giving everything that they can, taking care of our patients, making all the sacrifices. Okay. And being there in the front line, especially in the middle of the pandemic, risking their lives. So, this is the moment for us to thank and appreciate the efforts that we have for our fellow colleagues and nurses in the profession. Okay. All right. But anyway, everyone, infection control is our topic. So we have different types of questions for tonight, and hopefully you'll be able to get the right answer in terms of these questions on prioritization, and also a little bit of. I'm not really very sure if we have the delegation question tonight, but let's find out. So let's see if you're all ready, everybody. Let's have the first question for tonight, everyone, immediately. Okay. So first question, everyone. Okay. So the first question that we have is, a client is placed on airborne precautions due to active tuberculosis infection. Which interventions are included in this precaution? So a private negative pressure room must be used. B, an N95 mask must be worn at all times during client contact. C, the client should wear an N95 mask when transported outside. D, Clients infected with the same organism can share a room. Letter E, the door must remain closed. Or F, the staff must remove the N95 mask before leaving the room. So this is a select all that apply question, everyone. So again, a client is placed on airborne precautions due to active tuberculosis infection. Which interventions are included in this precaution? Select all that apply. A private negative pressure room must be used. B, an N95 mask must be worn at all times during client contact. C, the client should wear an N95 mask when transported outside. D, clients infected with the same organism can share a room. E, the door must remain closed. And letter F, the staff must remove the N95 mask before leaving the room. Okay, so let's try to check your knowledge about airborne precaution, everyone, because we all know that infection control is such a big deal in the NCLEX, especially knowing the mode of transmission of organisms and how you deal with airborne droplet or contact precautions. So of course, you really need to be aware of the different special principles. You need to know the principles in terms of airborne droplet and contact precautions. Okay? Airborne droplet and contact precautions, because they do ask this in your NCLEX examination. And of course, we want to give a shout out to the following students who gave their location for tonight. We have Joyce Jamila Flores from the Mom KSA, Axel Casarello from Las Piñas, Philippines. Okay. We have Emma Domingo Guerrero from Philippines, Gian Torres from California, Franklin Ayuk from Huntsville, Alabama. So if you have already your answer to this question, everyone, okay, so let's get the answer, everybody, okay? So this is a select all that apply question and very direct to the point, definitely. So this is more of a knowledge-based question, everyone. The answer to this question, everybody, will be letter what? So I think most of you got the answers correctly. Very good. So that would be A, B, D, and E. Very good. So that would be a private negative pressure must be used, of course. That is an information that I think 100% of nurses know. It should be a private room, negative pressure. And then letter B, an N95 mask must be worn at all times during client contact, definitely. Your letter D, clients infected with the same organism can share a room, of course. If someone has tuberculosis, then you can always have someone with tuberculosis as well. And then letter E, the door must remain closed at all times. And that is really to make sure that the air or the organism does not spread outside the room. Okay, very good, everyone. Now, your letter C is wrong because when the patient comes out of the room, when the patient is being transported to another area of the hospital or department, so for example, like an X-ray procedure will be done, then the patient should only wear a surgical mask, and we all know that, not an N95 mask. Your letter F, the staff must remove the N95 mask before leaving the room. That is wrong. Why? Because for letter F, the patient is supposed to remove the N95 mask once the patient is outside the room, not inside the room. Normally, the surgical mask or the regular mask can be removed before leaving the room. However, when it comes to N95 mask, it has to be removed outside the room, definitely. Okay? And then one rule about cohorting as well. When you say cohorting, that means that you're combining patients in one room or they are sharing the room. You have to make sure that these patients have the same organism, and at the same time, these patients do not have any other organism. So if someone has MRSA, then that person can be shared together with a person with MRSA as well. Or let's say you have TB and then TB patient. But if the other person has flu or the other person has any other infection, then you cannot combine those patients in one room. So remember that. Okay? So that's all about your droplet airborne precautions. Okay? In some hospitals, they even prohibit the dietary department or personnel from entering the room as well. Okay, so anything that I forgot regarding your airborne precaution, hopefully that you will remember all of these principles, everyone. Okay, all right. Now another one, everyone, is that what are the types of airborne transmissible organisms. What are those diseases that are transmitted airborne? That would be of course, your measles or rubiola, okay, your TB or tuberculosis, your herpes zoster, which is disseminated, and then also you have your, of course, so measles, chickenpox also. So your varicella or chickenpox is also airborne. So the technique in the NCLEX is this: remember all the airborne organisms so that the rest of the respiratory diseases will be droplet. Okay, so remember the airborne organisms, everyone. Your COVID, of course, research has shown that there is a possibility of your COVID being transmitted airborne as well as your SARS or severe acute respiratory syndrome, okay, or the SARS virus as well. But usually in the NCLEX, the most common airborne transmission will be your measles, chickenpox, TB, and your herpes zoster, okay, which is disseminated. So that's it, everybody. And then droplet, there's a lot of them. You have your meningitis, you have your RSV or respiratory syncytial virus disease, streptococcal pneumonia, your pharyngitis is also droplet, your mumps, rubella or German measles is also droplet, everyone. Okay, bacterial meningitis is also droplet, everybody. Okay, now your flu is also droplet. Your colds will also be droplets, and of course, for your contact precautions, you have for contact isolation, then you have your multi-drug resistant organisms, which are your C. diff, your MRSA, and also you have your VRE. Okay, and always never forget this: what are the PPE that you will use as part of your transmission-based precaution? For airborne, your PPE will be your mask, your N95 mask. For droplet, that would be your mask, and then for contact, that would be your gown and your gloves. All right, and of course, there's two terms that a lot of nurses usually have a problem differentiating. That would be your standard precaution and then transmission-based precaution. When you say standard precaution, everyone, that this is what we call before your universal precaution, your standard precaution. You're using PPE based on potential exposure to protect yourself and other patients. So, for example, if you are going to change the diaper of a patient, then you have to wear your gown and your gloves, for example. So when you say standard precaution, you're wearing PPE as recommended. Okay. But when you say transmission-based precaution, it means that you're wearing PPE as required. And for transmission-based precaution, there's usually a sign on the door before you enter the patient's room, a stop sign that says you have to wear the PPE. So transmission-based precautions are the ones that I mentioned, which are airborne, droplet, and contact, which means that the PPE that you have to use are required. Okay, so you call the transmission-based precaution. Now, what is your standard precaution if you're going to do wound irrigation or open suctioning of your patient? And I discussed this before. For open trach suctioning, for example, or wound irrigation, there will be splashes. And according to the Centers for Disease Centers for Disease Control and Prevention, they said that they recommend that for any potential splashes, then the nurse should wear, okay, your gown, your gloves, and then also your goggle or your face shield. So remember that in the NCLEX. Okay. So standard precaution. Always think what is going to be your potential exposure to body fluids, and your transmission based precaution will be what diseases your patient have. Now we usually combine your standard precaution with your transmission based precaution as well. For example, you're entering the room of your patient and your patient has tuberculosis, right? Your patient has tuberculosis, so your transmission-based precaution is to wear the N95. However, if your patient is having severe diarrhea at the same time, your standard precaution is you have to wear your gloves and your gown to protect yourself. Okay, so that would be your standard precaution, especially with severe diarrhea. You don't know what organism the patient has there. So that's it, everybody. Okay. Now, one reminder also for all of you guys is this: some disease conditions or diseases have more than one mode of transmission. Okay, a very good example is your RSV or respiratory syncytial virus disease. RSV is highly transmissible through droplet and contact. So CDC recommendation for RSV is always wearing your mask, your gown, and your gloves. Okay. Another disease that has a dual transmission, or two transmissions or mode of transmission, is your chickenpox. Your chickenpox is airborne, and at the same time it is contact as well. Okay, so just remember those diseases when you study, diseases that have more than one possibility of transmission, everyone. Okay, all right, and especially based on those transmissions, then you have to wear your PPE. Okay, so hopefully you're learning tonight, everybody. Okay, all right. So a lot of you are giving some comments there. Okay, I'm gonna be putting them in the shout out section later on. Okay. Anyway, everybody, let's proceed to the next one. We have the next question, everybody. We have your number 2. Okay. All right. So let's have. All right. The nurse is assigning rooms to clients in the nursing unit, which clients may share the same room. So this is what you call cohorting. So if in case you have to combine 1 or 2 patients together, or even 3 patients in one room. So is it A, a client with MRSA pneumonia, B, a client with multiple myeloma, C, a client with meningitis, D, a client with psoriasis, E, a client with cerebrovascular accident, or letter F, a client with herpes zoster. Okay, so again, the nurse is assigning rooms to clients in the nursing unit. Which clients may share the same room? Okay, is it A, the client with MRSA pneumonia, B, the client with multiple myeloma, C, the client with meningitis, D, the client with psoriasis, or E, the client with cerebrovascular accident, and F, the client with herpes zoster. So you have to click which patients can share the same room. It could be 1, 2, or 3 patients. Okay, as long as which patients can be safely combined together in one room, everyone. So which one would that be? A, B, C, D, or E, and F? Which patients can be combined together in one room? I would like to give a shout out to Noel Burgos for giving us very good feedback there. Okay. He says that not C, because patient can wear surgical mask during transportation to another unit or department. Not F. Okay, very good. Then also we have, okay, Mulu Hadera mentions about the airborne precaution, your TB, measles, herpes zoster, and varicella zoster as well. Okay, Dwayne, Brittany. So Dwayne, welcome to the class. My student every Saturday as well. Okay, all right. So put your answers, everybody. So cohorting is when you're placing together patients in one room, and always remember that hospitals may have their own policy and procedure also in terms of cohorting patients. So you always have to follow the general policy and procedures in the hospital. But in the NCLEX licensure, how do you, or what's one of the techniques and principles that you need to remember when you're putting patients together in the same room so that you're making sure that we maintain proper infection control? Okay. So the answer to this question, everyone, hopefully all of you got the right answer, everybody, on this question. So you're putting 2 answers, everybody, but let's see. Okay, the correct answer, everyone, will be your letter. Can you put your rationale, everybody? Why is it that you chose B, D, or E, or D and E? What is the reason why? What's your rationale for that? Okay. The answer, everyone, is going to be your B, D, and E. Okay, why? Now, letter B, why? Because multiple myeloma is a cancer patient, and cancer patients doesn't have any infection, do not have any infection, so they could be combined together with someone with psoriasis. Always remember that psoriasis is not an STD. Psoriasis is not transmissible. It is not infectious or contagious. So your letter D is okay. Your letter E, your cerebrovascular accident, of course, that is a condition wherein there's no infection present. So there's no danger of cross contamination or cross infection with letter B, letter D, and your letter E. So you have B, D, and E, everyone. Okay. Now, why is it that MRSA pneumonia? Well, of course, that's an infection. Meningitis is an infection, of course. You can cause cross contamination because that's a droplet infection. And letter F, of course, your herpes zoster, that's an infection as well. So there's always a possibility of cross infection, especially if the other patient has poor immune system, okay, or immunocompromised patient. Especially your letter B, you have to be very concerned about that because letter B is a multiple myeloma patient. Which could be on chemotherapy or generally it's a cancer patient. So we have to be careful with that patient in terms of infection, everyone. Okay, so letter B. Okay, so letter B is, so the technique here, everyone, or the principle that you have is that do not combine patients in one room if they have certain infections or certain organisms and they are transmissible. Okay, so remember that, everybody. Okay, so the answer is going to be your letter B, your letter D, and then your letter E, every one. Okay, so there's lesser chance of cross contamination with those patients, of course. Although for herpes zoster, one way that we can prevent transmission of that also is to cover the, if it is only localized, like a small area, then maybe what we can do is just cover the lesion. Okay, cover the lesion. But again, you have to be aware. Someone with no protection against herpes zoster may get your chicken pox. So there's a little bit of a risk there when you're combining patients with herpes zoster patients, definitely, because anyone with no titer or negative titer or protection against herpes zoster can get the chicken pox infection. Okay, or herpes zoster or shingles. All right, everybody, that was a challenging question, right? Okay, so more practice, when you have your Q banks, hopefully that you can remember the principles that I'm telling you here in this class. Okay, all right. So the fact that these patients have infections, we have to be careful. Okay, all right. Now, when you say droplet, everyone, droplet is an infection wherein droplet is a mode of transmission if someone is within 3 feet. 3 feet. Although we all know that for COVID, we are supposed to be 6 feet away for social distancing. But for patients with droplet infection, it has to be 3 feet away if in case we have to combine another patient in the room. It has to be 3 feet away. And for droplet infection, also, you can open the door. Okay. For airborne infection, the door must always be closed. But for droplet, the door can be left open. Okay. And that's it. Now, remember, for contact isolation, the difference is that for contact isolation, all the devices that you have in the room must either be disposable or they should be discarded or disinfected after use. You can never share the same devices like apparatus for patients who are on contact isolation precautions. Okay? All right, so let's have the third question, everyone. I hope you learned something, that guys. Can you please say yes if you're learning something tonight, everyone? Okay, so congratulations to Axel for getting the right answer. Okay, all right. Okay, so let's go to number 3. Which child may be assigned to share a room with a 6-year-old girl admitted for leukemia? A, the 6-year-old boy being treated for epiglottitis. B, the 5-year-old girl diagnosed with diabetes mellitus. Letter C, the 3-year-old boy who has Wilms tumor. Or D, the 9-year-old girl with scoliosis. Okay, again, which child may be assigned to share a room with a 6-year-old girl admitted for leukemia? A, the 6-year-old boy being treated for epiglottitis. Letter B, the 5-year-old girl diagnosed with diabetes mellitus. Letter C, the 3-year-old boy who has Wilms tumor. Or letter D, the 9-year-old girl with scoliosis. Okay? So thank you very much, Sylvia Calasio, for joining us tonight. And I hope that you're learning a little bit about our topic. Okay? So one of the questions that you will definitely have in the N class will be cohorting patients, and we're covering them for tonight, especially the basic principles that you may need they need to know. Now, of course, I cannot teach everything tonight. So if you're doing your Q bank, whenever you have these kinds of questions, please remember the principles being applied. Okay. So which child may be assigned to share a room with a 6-year-old girl admitted for leukemia. Okay, so which child, everyone, and you have to use your process of elimination. Okay, so Leah Aquino Fernandez. Okay, Vibrant Diane Rose is our student in the online academy. Okay, all right, so we have also Effie Nanya. Thank you very much for being here tonight. Okay, Emma Domingo Guerrero, Clara N, Selvi, Etohan, Osemwege, Amule. Okay, all right. So what's your answer for tonight, everyone? Okay, for this question. All right, so the answer for this question, everybody, is going to be, all right, so let's have the answer, guys. All right, so the answer is going to be letter B. So letter B, the 5-year-old girl diagnosed with, okay, diagnosed with diabetes mellitus, okay, with diabetes mellitus. So that will be your letter B, everyone. Okay, now why letter B? Number one, the reason is because this is a 6-year-old girl with leukemia. So this leukemia patient, of course, will be prone to infection because one of the signs of leukemia that we know is neutropenia, right? Or risk for infection. So the answer is letter B because number one, it's the same age and the same group, and usually your 6-year-old girl, 5 to 6, the characteristic of children 5 to 6 years old will be they prefer friends of the same sex, so same sex friends or peers. So that's why letter B is because both of them are girls. And at the same time, your diabetes is not an infectious disease. Did you get me, guys? Diabetes is not infectious. It does not say in the situation if the patient has ongoing infection. So letter B is safe. All right. Your letter D could be a possible answer. Your letter D, 9-year-old girl with scoliosis. Yes, because scoliosis is not infectious. However, you have to remember it's 9 years old. Okay. Now, 9 years old is not very close to 6 years old. So, as the child grows older, opposite sex friends may start to be considered. However, at the age of 5 to 6, that would be same sex. So just be aware of that in the NCLEX/ensure school age children like same sex relationships or peers. Okay, very good, guys. I hope that you got the right answer for that one. Very good. So somebody answered. Okay, so Noel said B, considering the age and gender, patient is also not infected. So very good for that. Okay, all right. So let's have the next question, everyone. All right. The registered nurse. Oh, sorry. I showed you the question, everybody. Okay. All right. So is that question number 4? Okay. So I think we deleted the question for number 4. Okay. So we'll just skip that question. Okay. Let me see if we have the other question first. Hold on, everyone. Okay. So we'll have the next question, and I would like you to answer this question, everybody. Okay. All right, so we have the next question, everyone, will be the following, will be this question. So let's see if you can get this answer, this question right. Maybe you saw the answer, I'm not sure, but I'll give you a chance, everybody. Okay, all right. The registered nurse should instruct the unlicensed assisted personnel to start routine morning care to which client first? Okay, letter A, the 26-year-old client who has fever and cough due to COVID-19 infection. Letter B, the 45-year-old client who has loose water stools due to food poisoning. Letter C, the 53-year-old client who is receiving cisplatin for advanced lung cancer. Or letter D, the 32-year-old client with osteomyelitis due to stage 4 left sacral ulcer. All right, everyone, what's the answer to the question? Letter A, B, C, or D? Again, the registered nurse should instruct the unlicensed assistive personnel to start routine morning care to which client first? A, the 26-year-old client who has fever and cough due to COVID-19 infection. B, the 45-year-old client who has loose water stools due to food poisoning. Letter C, the 53-year-old client who is receiving cisplatin for advanced lung cancer. Or letter D, the 32-year-old client with osteomyelitis due to stage 4 left sacral ulcer. All right, so I think we got the answer for this a little bit, and some of you are giving the rationale for this. The answer, everyone, is going to be, okay? So I would like you to put your answer, everybody. Why did you answer A, B, C, or D in this question? Okay, so let's see that question again. So you answered A, B, C, or D, everyone. Okay, so the answer for this question, everybody, is going to be letter. All right, so I think most of you saw the answer earlier, but that's okay, guys. A little glitch in the system there. So the answer is going to be letter C, the 53-year-old client who's receiving cisplatin for advanced lung cancer. Now, what's the reason? Cisplatin is a chemotherapeutic drug, everyone. It's a chemo drug, and you have to take care of patients who are immunocompromised before other patients. Okay, especially when you're talking about morning care. Okay, so the UAP should provide morning care to someone with advanced lung cancer first, so that you move to other patients. Now, your other patients here, your letter A has an infection, your letter B has an infection, and your letter D also has an infection, osteomyelitis. So you don't want to do those patients first, because when they reach the patient who is having lung cancer, there's a possibility of cross contamination. So we're risking infection, risk for infection in the patient who's having advanced lung cancer. Okay. So that's one technique in the NCLEX, to always prioritize your morning care first to patients who are prone to infection or at risk for infection, everyone. Okay, so the answer is going to be letter C. Now, if you have to put this in order, I'm not sure that is possible, but I'm really very sure that the last patient that you have to take care of is going to be the COVID patient, because the COVID patient is on isolation, of course, and we have to reduce the risk of transmitting that to other patients as well. Okay, so very good, guys. Now, are you ready for our last question for tonight, everyone? Are you ready for our last question? The last question is a prioritization question. So hopefully you can get this right, everybody. Okay? All right. So let's have the question. Four clients arrive at the same time in the emergency room. Which client needs immediate attention? A, the 56-year-old client was a positive TB skin test. B, the 35-year-old client was rashes due to disseminated herpes zoster. Letter C, the 63-year-old client was 8 over 10 pain scale due to a sprained elbow. Or letter D, the 32-year-old client who reports bloody stool due to ulcerative colitis. Okay, I will repeat. Four clients arrive at the same time in the emergency room. Which client needs immediate attention? A, the 56-year-old client was a positive TB skin test. B, the 35-year-old client was rashes due to disseminated herpes zoster. Letter C, The 63-year-old client who has 8 over 10 pain scale due to a sprained elbow. Or letter D, the 32-year-old client who reports bloody stool due to ulcerative colitis. A, B, C, or D. All right. Who do you think requires immediate attention? So we have Agonga Iniye, thank you for being here tonight. Also Iano Nimes, Franklin Ayo, Oleinka, Tati Magbeke, okay, Gian Torres, Emma Domingo Guerrero, Axel Jr. Casarello from the Philippines. Okay? All right. So the answer is you only need to pick one answer, everybody. Okay? Who will be the first patient that you need to see? Okay? Is it A, B, C, or D? Okay? A, B, C, or D. All right. So what do you think is the answer? So remember, the setting is you have to read word for word the question. Read the question word for word. Just don't jump at the option, everyone. So the situation is emergency room for clients. So which one will you see first immediately in the emergency room? The answer to this question, everyone, is going to be letter B, everybody, for someone with disseminated herpes zoster. Because your shingles or disseminated herpes zoster is a condition wherein you have rashes all over the body. And when it's disseminated herpes zoster, then you have to place the patient on airborne and contact precaution. It's airborne plus contact. Not only airborne, everyone, it's airborne plus contact for letter B, disseminated herpes zoster. Okay, so remember, B will be the answer. What I would like you to do, everyone, is to search in the internet how a disseminated herpes zoster looks like. Please search that in the internet how it looks like. Your letter A is not the answer. Why? Because it's a positive TB skin test. We do not immediately isolate patients with a positive TB skin test. Of course, there's no indication that the patient is having active TB. If letter A mentions that your patient has suspicious signs and symptoms of tuberculosis, like low-grade afternoon fever, coughing, losing weight, for example, then A could be a priority as well when you suspect your patient is having active tuberculosis. But the situation is only positive TB skin test. You don't necessarily have to isolate that patient. But however, probably you chose letter A because just looking at the word tuberculosis, then you say, oh, we need to isolate this patient. No, you really have to read the situation, and understand what's going on. So letter A is not the answer because we don't have any indication of a possible TB there, like an active or clinical TB disease. Now, your letter C is a priority also, a pain scale of 8 over 10. However, um, is that something life threatening? Okay, now your letter B is something that's important because we need to protect other patients from possible infection. Okay, so always remember, if a registered nurse is working in the emergency room, she's in the front line, and one of the primary responsibilities or competency will be to be able to sort out and protect other patients from any possible spread of infection. Your letter D, you have a patient having a bloody stool due to ulcerative colitis. That is a priority as well because that is circulation. However, letter D, that's part of the manifestation of ulcerative colitis. And then, of course, I'm not saying that letter D is not a priority. However, the fact that, bloody stool, of course, because of the possibility of anemia. However, it's not as important as letter B. Okay. Now your letter, all of these patients, if we add one patient in the situation A, B, C, and D, if there's a patient who has an airway issue, then always remember that airway comes first. Somebody with a very low pulse oximeter result, someone with respiratory obstruction, those would be priority patients as well. In this situation, letter B is your priority, everyone. I hope that you understood the okay, the concept there. Now, one of the One of the most challenging topics that students have a problem with understanding with will be the herpes zoster. Okay, and this is from the Centers for Disease Control and Prevention. Now you have to understand, everyone, that in terms of herpes zoster or shingles, it is a very tricky infection in terms of isolation precautions. So I grabbed this information from the CDC in terms of the recommendation for herpes zoster. Okay. Now, for herpes zoster, the CDC says that if the patient is immunocompetent, so meaning that if there's nothing wrong with the immune system, then if it's localized, you just cover the area. Okay? Just cover the area. However, if it's disseminated or all over the body, disseminated herpes zoster, then it has to be airborne and contact. So don't forget, guys, it's not only airborne, but contact at the same time. So don't forget that. If your patient is immunocompromised, okay, immunocompromised patients, it's airborne and contact precaution, even though it's localized, until disseminated infection is ruled out. So remember, if you have an AIDS patient, with herpes zoster, then we have to put the patient in airborne and contact precaution. And then the CDC further says that after dissemination is ruled out, completely cover the lesions and follow standard precautions until lesions are dry and crusted. So, meaning the bottom line is anytime that it is disseminated, it has to be airborne and contact. So you need to wear your N95, your gown, and your gloves also. Okay, especially your precautions until the lesions are dry and crusted. Okay, and also one thing that I would like you to remember, everyone, if someone has active herpes zoster infection or shingles, in the NCLEX also remember that any personnel with no protection or no prior history of chickenpox or varicella should not take care of a patient with herpes zoster or shingles, because the staff will get chicken pox. Okay, or let's say if someone has a negative antibody titer against herpes zoster, then that person should not be taking care of someone with herpes zoster, because the person will get chicken pox. Okay, so remember that, guys. And your herpes zoster is a disease condition that usually is triggered again by poor immune system. Okay, stress, poor immune system, and of course, study that topic because it's such a very interesting condition. Especially if you have herpes zoster, usually you have rashes along the course of the nerve, and that's why most commonly your herpes zoster could be found at the back, along your spine, only unilateral, only one side only. So very important this is condition to study for the NCLEX, everyone, especially the mode of transmission. Okay, so look at this slide again, everybody. I would like you to look at this and really study this very well, everyone. Okay. Okay. So that's it. Herpes zoster is airborne plus contact as long as you see the word disseminated. Okay, disseminated. All right. Okay. So very good, everyone. Pregnant patients. Okay, so somebody mentions about pregnant patients here too, so please search that information as well. So usually after the Facebook live, we put additional information or resources in the comment section, so please look at the resources that we put in the comment section for further reading, everybody. Okay, so additional information. So thank you very much, everybody. Now for tonight, I would like to plug in a little bit our, of course, our product. I can do it. The law of attraction, of course, your positivity is very important when you're reviewing for the NCLEX. So we have a steel tumbler that you can get from our website, everyone. It's really very nice. So yes, of course, think positive, and we do have a lot of products as well. Now another one, everybody, that I would like to share as well is going to be our online NCLEX Academy as well. So I'm going to give a little bit of a shout out to our program, especially what we offer in the online NCLEX Academy. Okay, so for online NCLEX Academy, all right. So number one, we do have the workbook. I have the book and we have the workbook. So the workbook is something that you order online in our website, and it has exercises. The one that you find in Amazon, my book, is really a reading book. Now the workbook has fill in the blanks. It has exercises, And then the workbook is something that you use online, when you review online, so you can use that. So we do offer 3 month subscription online. We have 6 months or 9 months or 1 year subscriptions. And also, don't forget that in May, at the end of the month, like Memorial Day, we're gonna have a sale, everybody. Okay, so we have the workbook, and then we have of course, the online access for you guys, the Facebook Live every Thursday. We provide it as well, and then also some quizzes. We have quizzes online, and all of the videos that we have in YouTube are all of our sessions. We also put that in the online academy, everybody. Okay, all of the sessions that we have done in the past are all in the online NCLEX Academy, everyone. Okay. So we do offer a 1 day free trial as well. So if you want to find out if this program is for you, then welcome. Try the free day one trial for the online access. So just visit www.matusnursing.review.com, or you can directly go to our online website, which is www.matusnursingreviewacademy.com. And for those who likes the online NCLEX Academy, can you please give a shout out in the comment section so others will be inspired and also may benefit as well from the program, everyone? Okay? All right. And lastly, let us congratulate the person who won last week. Okay? To the OB Galina Nike Tenko. So please congratulate Galina for winning last week. We do have a question in the comment section. If I got the ebook on Kindle, do I need to have the workbook? I will tell you the book and the workbooks have 99% the same content. It is the format that is different. The workbook is something that you use to write information or exercises while reviewing online, everyone. Okay? So I advise highly the workbook, definitely, especially if you want a comprehensive review, a more interactive review while watching the videos, everyone. Okay? Then another one, we have Loretta De Leon. She said, okay, thank you very much, Loretta. I really appreciate that for tonight. So it's worth the Facebook Live session, with your comment, guys. Thank you very much. Okay? All right, and then we also have a very nice comment from Clara. Your voice all ring in my ear when answering questions. Thank you so much. I give your book. I got your book. I bought from Amazon. A huge 10 stars. Thank you very much. Okay. All right. But anyway, everyone, thank you very much. And I hope that you learned something a little bit about our infection control. Always remember as well that last time we have covered a lot of infection control concepts in this Facebook Live. You can also visit all our videos in Facebook or in YouTube as well, everyone. We are now on section 56, everybody. So we have done a lot of questions in these sessions, everyone. Okay? Thank you. So Vibrant Diane Rose in the online academy also, she says she loves the ABG and the lab lecture. So we'll definitely keep watching. So thank you very much for that. And my last remember to all nurses, okay? So the title of my book, our platform and everything, the goal is a simple, fast, and easy NCLEX review, direct to the point. And my last reminder to everyone is to always think positive. If you feel like you doubt yourself, then always think positive and be disciplined and always think of your motivation to pass your NCLEX. I always tell my students, NCLEX is just around the corner. It's very important that you take care of your health. You need brain rest as well when you're studying. And the last piece of advice I always tell my students is that find the right resources that you will enjoy, because the most important part of NCLEX review is to enjoy learning, is to make sure that you learn so that when you pass the NCLEX, you are prepared to become a nurse. Okay? So thank you very much, everyone, and have a good night, everybody.